The blue light is not on yet. Okay. Hello, guys. We are sorry for the little break in transmission. We had a little glitch in our network problems, but we're back now and we are better. Okay. Now, I was talking about risk factors for breast cancer. Those people who need to be aware, who need to be increasingly aware that breast cancer is real and it's happening. Now, I was talking about people who has the risk factors or people who have higher chances than the normal person in the society to develop breast cancer. And as I said before, October is a breast cancer aware month from the 1st of October to 31st of October. That should show you that this is a serious thing. And this breast cancer awareness thing originated from the USA, from charities and funders of breast cancer groups who want to make people aware that this disease occurs and is a very deadly disease. And the best thing to do for yourself is, if you ever have it, to capture it early, because if you capture it early, it goes a long way in helping to treat it. Fine. I've gone through a number of risk factors. The first one I went through is the gender. The feminine gender has 100 times more chances of developing breast cancer than the female and the male gender. Another one also is age, commonly seen in women who are 40 years and above, but 5% of breast cancer cases also occur in females who are below 40 years. Another risk factor is family history. We said here that if you have a first family degree of people who have suffered breast cancer, like your mom, your daughter, or sister, who previously been treated with breast cancer, you have also increased chances of coming down with these diseases. Another one is if you have been previously diagnosed with breast cancer in one breast, there's also high 4 times chance that you might develop it in the other breast. So if you have undergone that, you are also needed to have frequent checks, screenings, and even mammogram examination to make sure that this breast that hasn't been cancer affected remains cancer free. And when eventually anything happens, you just dictate it on time and deal with it effectively. Another one is if you have certain benign breast conditions, maybe like fibrocystic change, fat necrosis in breast, women who do contact sports, when you slam a ball in a female's chest, it heals by maybe having fibrosis, or it can form fat necrosis. And that over time can also develop too. So if you have such benign breast conditions and it is now, you also need to be regularly checked to make sure that it doesn't develop to cancer. Another one, this was where I stopped before we had the clinch, was exposure, long exposure to estrogen. Like I explained, estrogen is the dominant hormone or the predominant hormone that makes a female, differentiates you between a man and a woman. The hormones that is responsible for breast development, widening of the hips, softening of the voice, and all the feminine features a lady has. It is kudos to estrogen hormone. And now, when you're overexposed to this particular hormone, it also predisposes you to breast cancer. Yes, but there are ways in which you can curb or circumvent this very risk factor. How? By giving birth early. If you give birth early or you've had multiple pregnancies, so you know that the time that you're pregnant, you're not menstruating. And when you're not menstruating, estrogen hormone is not really exposed. The body is not exposed to this particular hormone, thereby decreasing the number of times you're exposed to this hormone and then making you to be less prone to developing breast cancer now or in the future. Another one that can also cause exposure of estrogen to the feminine body is when you are on combined oral contraceptives. But the beauty of it is that if you have been on it for a long time, if you stop today, the risk of developing breast cancer stops today with it. Another one also is for postmenopausal women, that is women who have stopped seeing their menses and they still want to retain their figure feminine figure eight shape, and they put themselves on hormone replacement therapy with estrogen. Estrogen is the dominant hormone that makes a female a female. If you combine exposes you to breast cancer, but it's also known that if you just do post hormonal therapy with just estrogen, the chances of developing breast cancer is kind of reduced in this case. So that is it. Another one is a drug we call diacetylstilbestrol. This drug, I think, in the 1960s, were mainly used by women to prevent miscarriages. But it was now noticed over the years that any woman who uses this particular drug, you don't have miscarriage, but later in life you will develop breast cancer, or most of them develop breast cancer. And even the baby who you were trying to prevent from being miscarried over the time, over along the line too, will also come up with breast cancer. So it has been banned, but women who use it also are at a higher risk of developing breast cancer. And I want to agree that this time and age, no doctor prescribes that, and no patients use it at this time. Okay, another thing that also can cause breast cancer, can you imagine, is your weight. Yes, what you weigh can actually predispose you to breast cancer. Now, let's see this. Being overweight or obese has been linked to breast cancer risk. Yes. Yes. Women are running around in the gym, eating healthy. It's not only for you to look beautiful, use only diseases like breast cancer. Because as I just said here, being overweight or obese has been linked to breast cancer risk, especially for women after menopause. Yes, that is the age that women like want to like hang their boots. Oh, I'm done giving birth. I've got to marry. I'm now a grandma. I can eat anything I want. I can splurge on carbs. I can splurge on sweet things. No, this program here, your $1 billion body, tells you that taking care of your body, being fit, being healthy, being in shape, and maintaining a healthy weight, it is not about age. It is not about a time or a phase in your life. It is a lifelong thing. Being healthy is a lifestyle. Make it a lifestyle forever. Be you 19, 20, 40, 50, 60. Aim to be healthy. Aim to maintain a very good weight. Yes. And then it may be that the risk of increased if you have increased weight in adulthood, but not in childhood. In fact, let me rephrase that. Childhood obesity is more of a culprit in this case than adulthood obesity. Yeah. So we should aim to maintain a healthy weight. That's what I'm trying to say in a nutshell. Another one is alcohol. Yes. Alcohol. Even the Bible says that alcohol makes us happy, gladdens the heart, and makes us forget our sorrows. No doubt. But the catch here is don't overdo it. And alcohol, it is advised that moderation is the key. As a matter of fact, there's a study that proves that people who take alcohol moderately live longer than people who don't take alcohol at all. Yeah, it has been proven. So in this case, alcohol, when you should take it, should be taken in moderation. But when you abuse it, that's when it also predisposes you to breast cancer. So women who drink alcohol have an increased risk of breast cancer compared to women who do not drink. And the risk rises with the number of drinks you consume. Yes, if you were having like 5 bottles of beer and you increase to 10, your cancer rate also increases by 2. If you increase to 15, it increases by 3. If you increase to 20, it increases by 4, and all whatnot. So the more you consume in alcohol, preferably be a social alcohol drinker. Drink alcohol only when you're in parties and friends. At home, even if you have to take a wine glass, take a small glass and sip all through. A wine bottle can be in your fridge for 1 week and you're still sipping it. That way, you get the benefit of alcohol and avoid the side effects, such as breast cancer. Yes. Now, women who have been also diagnosed with other cancers that are not breast cancer can also still develop breast cancer. So if you've ever had or you know a person who's been diagnosed previously of cancer, they can also come down with breast cancer. So such a woman should be overly aware, overly sensitive, and have a high index of suspicion whenever there's anything abnormal going on in the two breasts. And therefore, it is advised for such a woman, you should be doing your own breast examination as often as 2. Now, we have come to the signs and symptoms of breast cancer. We've just dealt with women who are at the risk factors or who have higher chances of developing breast cancer than the normal population. Now, as we know, we are going to come to the end of this program, but uh, I want to give like everything I have in my brain because this month of cancer, we don't want no woman coming down with breast cancer. Now, let me quickly run through to the signs and symptoms of breast cancer because some people have it and they don't know. Fine. Number one is new lump in the breasts. You've had maybe like old lumps, and doctors say, no, this is a normal, this is a benign lump and nothing. All of a sudden, there's a new breast lump, or you've never had and you noticed a breast lump. You're not advised to keep it in the house. Go out, see your doctor, have it checked, and be rest assured that this is not anything sinister. Okay? That is it. Another sign that a woman has breast cancer is what thickening or swelling of parts of the breast. The breast is swollen or thickened. That is not normal. You should have it checked out. Another one is irritation or dimpling of the breast skin. What we call dimpling. This is the normal skin, and then it dimples like this. Comes here and enters inside. Just like it will just enter inside without anything holding it. It's dimpling. Something is drawing it from inside. The skin is dimpling. That's not normal. It's not. Some people will say, oh, yes, since I turned 30. No, it has nothing to do with age. Have it checked out. Another one is redness of the skin. Redness of the skin in the nipple area or anywhere around the breast. That is a sign. Very good sign to run into the hospital to have yourself checked out. Another one is a pulling in of the nipple. Yes, the skin can pull in. Also, the nipple that is supposed to be like this, you see it now, is now going inside. That is not normal. Not at all. It's not going, it's not normal. Pulling in of the nipple is a sign. Then when you have pain in the nipple area, pain, and you're not breastfeeding any child, and there's pain in the nipple area, you should go see your doctor or an oncologist to verify what the pain is all about. Another one is also nipple discharge other than breast milk. If you Some people can have black discharge from the breast. Some people can even have discharges that are milky in color, but you're not breastfeeding any baby, or you've not been pregnant in the last 5 years and your breast is discharging of milk. Sometimes they can even discharge blood. Those are signs that are not normal. They really are abnormal and you need to have it checked out. Now, another also is any change in the size or shape of the breasts. Your breast has been a particular shape and size, and all of a sudden is taking another turn. That is an indication that something is not going down well here. You need to get yourself checked out or screened for breast cancer. Another one is pain in any part of your breast. In fact, it's not just pain in any part of your breast, pain in any part of your breast and armpits. Yes, some people can have it like that. So that is it. Now, before we end this thing, if you don't get anything, let me show you something, because some people might now, after hearing this program, they will get freaked out. Now, don't be overly alarmed when there's nothing wrong with you, because when your breast is normal, you should know. So now let me describe for you what a normal breast is. Before I go into that, I will have you know that no woman has the same kind of breast. No, every breast tissue, breast fat is different. Now, if you've known what is normal for you, what is normal for you is normal for you. So if there's a person's breast is lumpy and your own is not lumpy, it can be normal for the person and not normal for you. So now, what is a normal breast tissue? No breast is typical. No. What is normal for you, like I said, may not be normal for another woman. Most women say their breasts feel lumpy or uneven. The way your breast looks and feel can be affected by your period. Yes, when you're on a period, it can feel different and even look different. But that doesn't mean that you're developing cancer. No. Another one is when you're having children, when you're gaining or losing weight, when you're taking certain medications, they can also affect the breast tissue. So it is in your interest to know that and know that this is normal with me, or because I'm having a baby, or I'm losing or gaining weight, or I'm on a place on a certain medications now. That is why the breast tissues are the way they are. So you don't get overly excited and start saying, "Oh, I need to go have a mastectomy." Mastectomy means radically cutting off one breast. No, don't be like that. No, in other words, the message here is know what is normal for you and know what is normal with you, so that you don't become overly alarmed and so that you don't become overly alarmed. But the fact that you have it doesn't mean that's a death sentence. No. If we catch it early, you can be treated and you can have complete or total remission and go about your normal life. So this again is your beat onto the body fortnight with more breast cancer, because this month is all about breast cancer. And here, Dr. D and the Billion Dollar Body Program wants to let you know that we are here for you. Any questions, any concerns, any queries, direct it to us. We are willing to take care of your questions and then direct you accordingly. Okay, all right. Okay, so we are also trying to thank our sponsors, Salad Masters, for sponsoring this program and letting it get to you. Okay, so now from me to you, it is good night and stay blessed. And remember, nothing tastes as good as healthy does. Stay healthy.